The following may not be suitable for all audiences. Viewer discretion is advised.
BIGWU prepared to take RBL to court for their policies on COVID-19. The Banking, Insurance and General Workers Union, BIGWU, is prepared to take Republic Bank Limited, RBL, to court for their policies on COVID-19 vaccination. The union again met with the bank's representatives this week following correspondence received from the bank's group industrial relations manager Preston George, BIGWU stated in a press release on Thursday. In a release on Thursday, BIGWU stated, due to the bank's reliance on semantics to defend their position, the union will have no further alternative than to seek urgent legal redress. Last week, BIGWU told RBL to obtain proper industrial relations protocols for their COVID-19 policies for the intended full return of staff in September. BIGWU's second vice president, Jason Brown, stated, the union continues to be supportive of all measures that seek to reduce the spread and associated ills of COVID-19 in the context of good and proper industrial relations. However, the union is opposing the unilateral imposition of the costly PCR test on the unvaccinated, the unethical use of monetary bribes to achieve their agenda of herd immunity, the threats of disciplinary action, and other prejudicial treatment against the unvaccinated. Brown said the union will strictly oppose the new terms of employment which were made without consultation with the union. The bank, likewise other businesses, has stated that unvaccinated workers will be allowed at workplaces. However, they must be subjected to regular PCR tests at their own cost. The Ministry of Health has recorded 6 additional COVID-related deaths, bringing the total number of deaths to 1,258. There are currently 283 patients in the hospital. The ministry has also recorded 212 new cases in the last 24 hours. This brings the total number of active cases to 4,838. The Ministry of Health will verify your immunization record via telephone. The Ministry of Health is engaging in a verification process to ensure that the information provided on the immunization record cards is accurate. In a media release on Wednesday, the ministry stated, where required, ministry representatives are contacting members of the public via telephone to confirm the information provided. This exercise is being conducted on behalf of the Ministry of Health, and representatives will identify themselves prior to obtaining the information. The public is assured that all information is treated as confidential and will only be used for official record keeping as the ministry moves towards the digitizing of its immunization records. Members of the public are asked to cooperate with the ministry's representatives conducting this exercise, and are advised that they can verify the legitimacy of these calls and representatives by calling 627-0010 or 627-0011 or 627-0012, extension 1750. There are 2 more cases of the Delta variant of the COVID-19 virus in Trinidad and Tobago. The Ministry of Health reported on Wednesday evening that as at 6:09 p.m., the cases were confirmed. T&T now has 5 confirmed cases of the Delta variant in the country. The ministry stated the 4th and 5th patients recently returned to Trinidad from the United States and Guyana, respectively. Following quarantine protocols, both persons provided negative PCR tests which were taken 72 hours prior to arrival. The ministry stated, as a result of their positive COVID-19 results from swabs taken after arrival, both patients were isolated at a state step-down facility. The patients will remain in isolation until they meet the enhanced discharge criteria for persons with COVID-19 variants of concern. The presence of the Delta variant was confirmed via gene sequencing at the laboratory of the Faculty of Medical Sciences, University of the West Indies, the ministry stated. With the increase in Delta cases, the ministry reminded the public that the Delta variant was more transmissible, and evidence indicates that individuals who have contracted this variant may be prone to an increased risk of severe illness and hospitalization. This variant may also lead to an increase in cases of COVID-19 in younger age groups and in those who have been previously infected. The Ministry of Health stated that vaccination can prevent adverse effects of the virus and urged the population to maintain all health protocols. Ministry of Health reports that there are no COVID-19 vaccine deaths. The Ministry of Health says there have been no deaths in this country due to the COVID-19 vaccine. The following is a press release from the Ministry of Health. The Ministry of Health takes note of incorrect statements in the public domain suggesting that there were deaths due to COVID-19 vaccination. The population is advised that as at 26th of August 2021, Trinidad and Tobago has had no deaths due to the COVID-19 vaccine. The public is reminded that they should only get updates from reliable official sources such as the Ministry of Health and Regional Health Authority websites and social media pages. The ministry will continue to inform the public on matters relating to the national COVID-19 response. No Independence Day Parade. There will be no Independence Day parade this year as the country remains in a state of emergency (SOE). Minister of National Security Fitzgerald Hines issued a media release on Wednesday stating that the present COVID-19 situation did not allow for the customary military parade in Port of Spain. The release stated, after careful consideration, it was determined that the safest option would be to forego hosting any parade this year. The Ministry of National Security takes the opportunity to wish all citizens of Trinidad and Tobago a happy 59th independence. The public is also being reminded by the ministry that all public health regulations remain in place.